All right, so Tanya, you were discussing something very important that you have found many patients that are trying to work with lifestyle changes and they are struggling with weight loss. What was that you found out and what do you think that the patients should do? And including her in this case, what was the discussion?
So we talked about the 14-hour fast, and I talk about the 14-hour fast with just about everyone that comes in. And a lot of times what I find out is in the morning, what is common for most of us is we have a cup of coffee. So I commonly ask, what do you put in your coffee? And a lot of times people are telling me the flavored creamers. So as we discussed, the coffee creamer has sugar, and we wore CGMs for a while to see like exactly what that sugar in the morning, even like a splash of creamer in your coffee does. And it personally spiked my blood sugars to 144 when I used it, which was the highest it was all day for anything that I ate. So we talked about what we can do to switch that out and still get your coffee in the morning, because a lot of us run on coffee, right?
Yeah.
And we said heavy cream.
Yep.
And you think that you can do that, right?
Yes.
And by doing that and not spiking the index, the glycemic index, we can get the full 14-hour fast without breaking it, so we can get some fat burn in every day. And you were thrilled.
Yeah.
Yeah, but we also said, and I think you agreed with me on that, that these are actually not milk. These are not milk, right?
No, there's no refrigeration needed.
Yeah.
So if it was a milk product, it would have to go in the fridge. So what we've got is chemical compounds.
Otherwise, try leaving the milk or heavy cream or butter or anything outside. I don't know how many days it will last, right?
Yeah.
It will go rancid. So this is the reason that those things are pure chemicals. They cause inflammation in the body and they spike your sugar, right?
Yes.
So it's a good advice, Tanya. You're learning the science and you have wore the CGM too, correct?
Yeah, I wore it for a couple of months.
What is the purpose that you think that we encourage people to wear the CGMs?
I'm under the impression, and I wore it for a training. So I learned how to figure out what I would eat and whether or not it would cause a spike